Despite healthcare advances and data showing longer lifespans, men are still dying nearly 5 years earlier than women. Men have higher mortality rates than women for 9 of the top 10 leading causes of death in the United States. With us today to talk about the topic of men's health and how to live a healthy life is State Surgeon General Dr. Joseph Ladapo. Welcome, Dr. Ladapo. What
Thank you
is
very much.
going on with the men?
Well, if we put aside for the moment that women have some just natural advantages in terms of judgment and decision making, which I think I have to say that on average, women definitely have better judgment than men.
You know
There
I'm
are
not going to
some
disagree with that, right?
there are some very specific contributors to why men unfortunately do have higher death rates than they would otherwise.
What are
A
some of
major
those?
one, yeah, a major one is cardiovascular risk factors. Cardiovascular disease is the leading cause of death, and men often engage in behaviors that don't help us in that regard.
What
Some of
kinds
those
of
include
behaviors, in case there's some
absolutely.
men watching who are going, I'm good?
Absolutely. And that behavior right there, the I'm good and not examining ourselves. But on a serious note, physical activity. Too many men are sedentary, not getting that aerobic activity, whether it's walking around, whether it's jogging, swimming, playing basketball, just being using your body, getting off the couch, moving around.
Hmm.
Another major one is smoking. Men smoke at higher rates than women, and smoking is probably the leading preventable cause of death. So that's another area where men unfortunately are performing at a rate that is, that's higher than women, but in a bad way. We
What
need
about
fewer men
stress?
smoking.
What about stress? How much of a factor does stress play in mortality
Yeah,
rates?
yeah, that's a great question. That's actually such an excellent point. It's really interesting because while a lot of what we think about in terms of machoism is men being really tough and that being the ideal man, if you will, at least in
Hmm.
some people's views, it turns out that there's research that shows that in fact women generally are more able to adapt to stress. Women are more able to tolerate pain. So, stress is a risk factor for heart disease, for cardiac death. Stress is definitely a risk factor for shortening our lifespans. And in fact, women tend to be more able to adapt to it, to really take it in, process it, share it with other people, talk about it, rather than kind of holding it in or resisting it, which you find to happen more commonly with men. And that's not good for your heart. It's not good for your mind. It's not good for your spirit.
Are you finding that younger men are becoming more conscientious about their health? I mean, can you point to generational differences to account for some of these numbers?
That's a really great point. There absolutely are a lot of generational differences. But at the same time, while some generational differences, in terms of, for example, buy in into some macho habits that are actually not very good for our health, while some of that is declining, we're also seeing other things rising that counter that. So, for example, the effects of social media, often with people relating so much to it and replacing real reality with social media reality, isn't good for boys or girls. It's actually harmful for everyone's health. So I think while some things are getting better, we have a lot of other factors that are unfortunately getting worse.
So, what can we do, for people who are watching and going, oh, maybe I'm not moving enough, maybe I'm not eating the right things, maybe I am engaging in dangerous behaviors. How do I turn this around? What do you tell them to start turning that ship around?
Yeah, and that's such a great question. I think really the first step is to know thyself, because changing behavior is really challenging. I mean, it's such a challenging thing, but part of achieving that goal is really trying to be as honest with yourself as possible. Because if you're honest with yourself, you're going to have a greater ability to identify those areas that are going to be weaknesses for you. And you don't have to be perfect, but if you at least know what's off, where you're more vulnerable, you have a better chance of really addressing those areas. So that's literally, I think that might even be the most important step. And then
And
beyond that, yeah,
and
yeah.
actually going to the doctor for checkups.
I think that is also very valuable. And oftentimes, doctors have very good feedback about things that we can do for our health. But even then, as a doctor myself, I can't tell you, you come into the office and doctors know what they're talking about. So they think that when they talk, the patients understand everything they're saying. But so often, patients walk away with a very different understanding than what the doctor communicated. So even with doctors who do wonderful work, still that personal accountability, that personal responsibility, that is the most important step, because you spend this amount of time in the doctor's office and then you're out in the world. You're making choices about what you put in your mouth. You're making choices about your physical activity. You're making choices about how much sleep you get. And those actually make a bigger difference overall than the few minutes you spend with your great doctor.
So I guess we could sum this up by what you said, know thyself and start with the man in the mirror. Dr. Ladapo, thank you so much for insight. And hopefully this will help some of the men out there take notice and take action. Thank you.
Absolutely. Yes. Thank you.
Getting screening tests is one of the most important things that men can do for their health and to help them live longer lives. To learn more, visit floridahealth.gov.